The strategic goals, transforming the culture. This was sort of probably the number one topic that came through. And this came through in quite a sophisticated and quite complex arrangement of working groups. And remember, this was coming from people within the service itself, including patients and carers and clinicians. It was not a top-down approach. And about the transforming the culture was all to do with, have we yet reached that stage where we can say, as someone said to me, that the most junior nurse in the operating theatre can turn to the most senior surgeon and say, I'm sorry, doctor, I think that's wrong, or I think there's a mistake here, we're in danger of doing harm to this patient. Will people actually report adverse incidents when they happen? Will they report near misses? Will they actually see it as actually vital? As people in the aviation industry, for instance, where there's a no-blame culture, and they have a very clear view that it's an absolute must that every single adverse incident of any kind, including near misses, are reported. That's why the aviation is the safest form of travel in the world. Interesting statistic, by the way, in terms of patient safety. Your chances of incurring serious injury or harm when you're admitted to a hospital anywhere in the UK is about 1 in 350. Now, I don't mean death, but it could be a medication error, about 1 in 350. That's your chances. I'm not sure whether people generally recognise that. Do you know how many flights go out of Belfast City Airport every week? 350. So how would you feel the next time you go to Belfast City Airport if you knew that one of the flights this week was the flight that you were going to suffer harm in? You wouldn't fly. But that's the difference in terms of this highly sophisticated, highly quality and safety-focused industry called aviation that has moved over the last 50 years to a point where the culture is very much about knowing when things have gone wrong or nearly went wrong and ensuring it doesn't happen again. That's why it's so safe. We have to change that culture. Strengthening the workforce. We have to recognise, first of all, that we have an excellent workforce, but an excellent workforce that needs strengthened. It needs new training, it needs added training, it needs focused training. And I'm saying this at a time when budgets are being sort of severely constrained. But training can be done and achieved in many ways, not just sort of formal training courses. We need to have a new approach to training so that the workforce is actually emboldened and strengthened and empowered to actually deliver quality and want to continually improve quality on a day-to-day basis. Measuring the improvement. Not that we lack statistics or data in health and social care. God knows we have enough to bury the Mourne Mountains. It's just this incredible amount of data and information. But yet nobody can say that the system is safer this year than it was last year. And I can show you the evidence. Nobody can say that the quality of health and social care has increased this year as opposed to last year, because we don't have the measures. Or at least we don't have a systematic approach to actually how we make use of information and data to enable us to measure improvement and to know that we're actually making progress on that journey towards 2020. Raising the standards. Again, the work that's been done by NICE and by GAIN and by SKY, we have a tremendous volume and evidence base now to show us the most effective ways of actually delivering health and social care, the most cost-effective ways of doing that. The problem is we're fast approaching a point where the numbers of standards that are proliferating are going to become unmanageable. And some standards are gold standards, some standards are minimum standards. We need to make this much more coherent and much more focused so that it's actually pushing us in the direction of a coherent pathway of quality improvement. And finally, integrating the care. We pride ourselves in Northern Ireland of actually being, the health and social care service, and England are now at last catching up. In fact, they invariably do. Over the years, I've found that they've followed us in our education policy. They followed us in quite a few other policies in Northern Ireland. So they're now catching up. They're now adding in the social care, because we know how great it is and how integrated it is, and the great added benefits that it delivers for patients and clients. I wish. Because as many of you know, or if you're prepared to acknowledge it, sometimes the maximum integration is that you get different disciplines occupying the same building, and that's where it ends. They might have lunch together, but actually working together in truly integrated teams, integrated care pathways, even the business of patients being discharged from hospital going into the community and into primary care. Oh, it's so integrated, isn't it? It doesn't lack anything in terms of quality. There's so much more that we need to do to actually make that integration a reality for quality improvement. And two of those particular goals, I think, are of particular relevance to GAIN, and those are to do with measurement and standards. Because we need that evidence of success in learning. We need to know, in fact, where things are improving and how well they're improving, so we can learn from that and do the same again in other places. We also need evidence in terms of measurement to motivate, reward and resource. Because one of the problems that I find is that increasingly measurement is used almost like a big stick, in that targets and performance indicators are set as a means of hitting you over the head, rather than as sources of learning, sources of motivation. I have seen systems where performance indicators, for instance, are used to motivate people and genuinely can motivate them as long as you understand how the information will interact with people's behaviour. But we have so much more to do in terms of measuring quality and understanding how that can be best impacted on the service and on changing people's behaviour. And the standards, in terms of guidelines and standards, one of the work of GAIN, the work of the service frameworks teams that we've been seeing unfold now over the last few years is a tremendous example of where we've been able to harness the terrific energy and commitment and expertise within our own service, allied with the information from groups like Sky and NICE, so that we develop the standards for Northern Ireland by Northern Ireland. There are standards, they're the standards that best suit health and social care in Northern Ireland and nowhere else. That's going to be key to actually developing that high quality service. Auditing to improve quality. I mean, GAIN has a key role in this in the future, and I look forward to a long and very fruitful business relationship with GAIN in that regard. And finally, the strategy delivery. It's all very well having lots of rhetoric and fine words, but in fact, if we don't have a mechanism that will actually make this happen, then it's all quite pointless. And what we have proposed in the strategy is that we'll have three elements to this delivery mechanism. One will be a management process. So we'll have a programme board. It won't be the first, it won't be the last, but it'll be a programme board that brings together the key players in actually driving forward the work that needs to be undertaken. And it is a lot of work across a lot of places, a lot of settings, in actually achieving these strategic goals. But as well as that, we're proposing a quality advisory forum, a group that sits outside, a group that in fact will comprise patients, carers, academics, trade unions, a lot of interested parties, frontline staff, but no suits, no senior executives. Not the great and the good, but the real people, so to speak, who have a real vested interest in health and social care services. And this group will have an input to the work and the thinking and the planning of the programme board to ensure, in fact, that its progress in delivering the quality strategy is meaningful and credible. And finally, for the health and social care bodies themselves, reporting on delivery of that quality improvement. Most trusts now would have in their annual reports a section on quality. That's very fine and very, very, very laudable. What we now want to do is move that a step further forward, but actually have a discrete quality report, not the quality accounts that have been developed in England, something subtly different that actually enables trusts themselves to show what they're doing by way of improving quality year on year, as well as their role in contributing to more regional and strategic priorities as maybe set out in government's priorities for action. So in conclusion, the strategy has been out for consultation now since the middle of January. I'm thrilled to say that we have already had several responses, although the closing date is the 14th. You equally with me, I think, will be thrilled to know that the very first organisation to respond to the consultation on the quality strategy was the Irish Football Association. I'm sorry, I'm still struggling to understand the letter I got. It was hilarious. We thought they'd misdirected it, but it turned out that there was a chap in the IFA who'd actually read the document. But there you are, it just shows you it's actually got further than any of us could have predicted. But I would make an appeal to individuals, to organisations. Responses to the consultation are absolutely crucial. If you think it's rubbish, then please say so. If you think it's the way to go, then please say so. Or any other comments in between. 14th of April, your comments will be extremely welcome. And we have to get health and social care buy-in. It will be essential. So there's still a lot of work to be done to actually bring people with us. This is not Jim Livingstone's strategy, or let alone the department's strategy, so to speak. It's a health and social care strategy. Having the right visions and goals is vital, and that's why we need your comments to actually refine it insofar as it can be refined, so that we can ensure that in fact it is credible and that we bring people with us. And it is about protecting and improving quality. So if the will is there, we can be that international leader for excellence. Anything's possible. Thank you very much.